Hello, everyone. In today's video, we're going to be talking about the subjective examination of a physical therapy exam. So as I've started to work with and interact with more students, I've realized that having frameworks in place is extremely helpful as you start to navigate these clinic rotations, whether it's your first, your second, third, even your finals. Starting to put these systems in place can be extremely helpful in improving your confidence and systemizing the way that you approach your treatments and your plans of care. So today I'm going to go through my exam flow, some things that I make sure and ask, how I organize things, and hopefully you can take some bits and pieces of my exam and start to implement them into your own treatment style. I always start by saying, I reviewed your chart. I see that you're here for X, Y, or Z. So maybe that's right shoulder pain, left knee pain. Tell me a little bit more about what's going on. And there it is. I just open the floor. I give them a moment to kind of tell me exactly what they've been experiencing, what they've been dealing with. And this is really their opportunity to tell me anything and everything that they want. It's like their opening statement. I'm just going to sit back, listen, and then based on what they say, that'll kind of guide my follow-up questions. But it's really important early on that as you approach these patients and are listening to hearing what they're saying, you're making sure that you're capturing their mechanism of injury, if there was an injury involved, when the onset was, when did this start, and then the progression, how have things changed since that initial onset. So if they've mentioned some of these things during their opening statement, I won't ask again, but if they're skipping right over them, you need to go back and you need to establish where they've been to now, so you know that where you're going to end up going with the rest of the evaluation and furthermore into your plan of care. Next, I'll make sure that I hit on pain. So I always try and rate any pain, discomfort they're experiencing. I'll have them describe it, maybe point to it if you're trying to get a little bit more specific or rule in or out certain structures and conditions. And then from there, I like to go into what aggravates their symptoms, what alleviates their symptoms. So starting to gather a better understanding of what sorts of activities, what movements are comfortable, as well as which movements typically, increase discomfort. And all this is starting to paint a better picture in my mind of, how they're moving, how they're living, and things like that. So I can get a better understanding of, okay, like what sorts of interventions will I have in like a checklist of things I might want to go through. After this opening period where we kind of address everything leading up to now, the pain they're experiencing, I like to get a picture of, who they are as a person, what their typical day looks like. So I'll typically ask them, hey, what does an average day look like for you? What sorts of things are you doing either at work or at home? And I split up this category just that way. I start with work. So figuring out what do they do, get a little bit more specific. Are they having any issues at work? Are they currently working? So getting a really good picture of what their work life looks like, because it's a large portion of the day for most people. Next, you want to get a good idea of what their home life looks like. So what's your current living arrangement? Do you live in a house? Do you live in an apartment? Do you live in a mobile home? Are there any stairs? Do you live with anyone? What kind of support do you have at home? All those questions can help you get a better understanding into someone's day-to-day, someone's living situation, any potential obstacles that they might have at home. And then lastly, I always like to touch on some of the personal pieces as well. So asking some things like, what sorts of hobbies do you enjoy doing? What do you do when you're not at work? What sorts of things do you enjoy doing that you haven't been able to do lately? Really trying to build rapport with that question or that line of questioning, go a little bit deeper and figure out what matters to these people. And then after you go through that series, the next piece is I always like to summarize everything I've heard so far. So sometimes you might think that you're gathering everything that people are saying, but you might be missing, crucial pieces. So I'll say, all right, this is what I'm hearing. Let me know if there's anything I'm missing. And then we'll kind of make sure that we're on the same page before we move forward. So then I'll give my little summary. I'll say what I've heard. I'll review my notes, and then I'll just be like, okay, does that make sense? Does that kind of align with what you're saying, or are there big pieces I'm missing? And they'll usually jump in or correct you or be like, oh, okay, yeah, for the most part, that's exactly what I'm dealing with. But I also just want to make sure that you're aware of an X, Y, or Z. And then from there, it's going to be very important to lead into their goals. And I like to kind of lay out some goals that I'm hearing based on what they're saying. Because a lot of times you'll say, okay, what are your goals? And the patient will sit there, goals, goals. Like it's almost like a task for them to come up with the goals. So if you kind of lead them in, but maybe saying things like, so it really sounds to me like you need to get better at walking upstairs, carrying things. I mean, these are all tasks you need to do at work. So just getting you a lot more confident doing tasks day to day at home, at work. Um, I think you're going to put you in a really good spot. Is there anything else you want to make sure that we're focusing on? So kind of phrasing it like that can be helpful too. And then after you kind of establish those goals, I'll jump right into like a review of systems. So I'll say, okay, I just have a few more questions for you to make sure that we're not missing anything. And then these questions will all just be yes or no. And then I'll dive right into my review of systems. My approach for review of systems is I'm lucky enough to have access to Epic, so I can see their past medical history and kind of pick out big pieces I'd want to hit on. Like maybe they're in cancer treatment, maybe they're recently had a surgery or have an upcoming surgery. But if not, if you don't have access to some of these things, then I'd just do a top to bottom chart review. So I always start with start up top. So ask if there's any headaches, dizziness, changes in vision, anything like that. And then I'll usually go down. So now we're at like chest level. So I'm asking any shortness of breath, tightness in your chest, difficulty breathing, anything you want to rule out for heart, lungs. You can go right there. And then moving further down, I'll ask about nausea, vomiting. If it's low back pain, sometimes you can ask like about genitourinary questions. So really depending on how your patient presents, what past medical history they bring up, you can add in questions for review systems as you go down the line. But once you get through that portion, that's pretty much it for subjective. You should have a really good understanding of what you're going to do objectively moving forward. With the subjective portion, they say that you should be able to have 80% of your differentials, 80% of your exam is that subjective. So just listening, conversing, and really thinking too, like think why you're asking certain questions, what additional information it's giving you. Because I think one of the most challenging things early on is we've got this big list of questions. We feel like we need to hit on everything, but we're not necessarily listening to and hearing what the patient's saying. And we're not necessarily asking follow-up questions. So if you want to get really good at the subjective, trying to actively listen, ask good follow-up questions, and think why you're asking what you're asking. This will put you in a really good position to move forward with the rest of your exam, establish rapport with the patient, and get your treatment off to a fantastic start. So hopefully this video is helpful, and we'll see you in the next one.